Hello, my name is Mauricio Duarte and this is my Module 7 for Medical Terminology. I am Mauricio Duarte, MD from UT Southwestern's Urology Department. I am charged with studying urinary tract infections and anything that deals with the urinary tract of both men and women. I, in addition, study the male's reproductive system. My main focus in my studies is the population of older men from the ages of 40 to 60, as nowadays a lot of men go through benign prostatic hyperplasia. This particular condition is where the male undergoes through an enlargement of the prostate gland, and many patients claim that it's very unpleasant as it is uncomfortable to urinate, as this condition blocks the flow of urine from the bladder. With the blocking of the urine, many men are prone with kidney, bladder, and urinary tract complications. The most effective way to get rid of this complication is through transurethral resection of the prostate. This surgery lasts about 60 to 90 minutes, but it all just depends on how much prostate tissue is in the way of the urinary tract for the flow of urine to leave the body of the male. Last month I had an economically deprived male Hispanic patient of the age 48 that was diagnosed with benign prostatic hyperplasia. In the past, the patient was diagnosed with a urinary infection and was treated with antibiotics. This may have had an impact on him getting a light case of benign prostatic hyperplasia. The patient was placed under the transurethral resection in order to cure his prostate enlargement. The patient's penis was penetrated with a resectoscope to reach the prostate gland. I proceeded with taking small incisions of the prostate gland tissue slowly. This procedure took about an hour as the patient did not exhibit an extremely large prostate enlargement. After surgery, the patient was left with a catheter to help with urination. After 2 days, the patient was able to urinate by himself as the sweating was lowered. I recommended this patient drink lots of fluids and ate a lot of fiber and avoid any physical activity for a fast recovery. This allowed the patient to be able to urinate within 2 days. But I did tell the patient that there would be blood in his urine, but this is normal as we did small incisions to the prostate tissue, so blood in his urine is normal. There is not really anything that could prevent the prostate enlargement within men, but one thing that I do recommend is that exercising and eating healthy can help manage the prostate and the flow of urine. Another thing as doctors is that we could help out people by providing resources, knowledge about these conditions that may or may not have. And us as doctors, it's our job to inform the public about these different problems, as people may not know they actually have, so we need to get them treated. And also, I as doctor, I would like to encourage payment plans or some way of allowing economically deprived people to get treated, as they may not have any way or form of paying or getting treated. So that is my number one problem, that as we doctors could bring these people's voice out to the medical field so they could get treated and help the economically deprived population, as they may not have the resources as other people. Thank you.